All right. Hi, everyone. Thank you for joining me today. I'm very excited about today's kidney cancer conversation with Dr. Bobonis with Moffitt Cancer Center, where she is the vice chair of the Department of Supportive Care Medicine. And today, she's here to talk with us about coping with cancer and caregiver stress. Dr. Bobonis, thank you for joining us.
Thank you, Scott. Happy to be with you all.
We will have a Q&A session at the end of today's talk. So if you have questions throughout the presentation, feel free to type those into the chat box and we'll make sure that those get answered then. So without further ado, please take us away, Doctor.
Thank you so much. Thank you for having me. It's a pleasure to join this afternoon with you for a little bit. I'm excited about talking regarding coping with cancer and caregiver distress because this is a topic that is very pertinent nowadays when we're dealing with chronic medical illness, including cancer. Today's goal for the talk is to have an open dialogue and hopefully talk a little bit about challenging emotions that may cause distress to not just patients, but also caregivers in response to dealing with chronic illnesses like cancer. So I would like to start by saying that all of us as creatures of habit like routine, and there's no surprise that our brains like familiarity just because it's easy, it's effortless, and makes us all feel safe and comfortable. And not surprisingly, when we don't have to think too much, life is easy and is comfortable getting through days without many changes. But when we have cancer or there's a cancer diagnosis in ourselves or a family member, this can disrupt that routine, making coping quite hard. Having to deviate from day-to-day routine to attend to medical needs, appointments, taking medications, or other changes can be quite stressful. And that brings uncertainty about the future, which also brings a whole gamut of difficult emotions. So making decisions under uncertainty can be quite hard, but it's certainly not impossible. And some of the feelings associated with uncertainty include worries, anxiety, sadness, guilt, blame to self or others for behaviors or attitudes from the past, stress, loss of control, insecurities, shame, anger, frustration, and sometimes confusion, a sense of loneliness. But after a diagnosis of cancer, not just the patients, but also the caregivers experience what we call grief. And grief is nothing different than a normal process or response to an anticipated loss. The duration of it, as many patients often ask, can vary. And those variations depend on the age of the person, the values, their belief, what coping strategies they may have in their repertoire, what their support network is, and other different variables. The process of grief is not orderly. You may see the graph and you may see the order, but it can happen in any different form. Some patients experience all of them, some others don't experience all. And the timing of it can vary as well with each person's circumstances. The grief work, as we call it, requires living with the loss in an effort to learn from it. And the ultimate goal is acceptance and adaptation to the process that is happening in your life. There's different stages of grief, and although I will mention them in a specific order, as I mentioned before, they can happen in many different ways. Denial, for example, is when the world seems meaningless, it's overwhelming, life makes no sense. Patients may feel numb, they may wonder how they can go on, if they can go on, and why they should go on. The truth is that denial can help And it helps us filter in what we can handle little by little without opening the floodgates and making us feel overwhelmed.
Doctor,
Yes.
I believe we had an internet hiccup for just a moment because your screen froze for about 10 seconds.
Okay.
We missed what you had said just a moment ago.
So are we still on the grief stages?
Yes.
Okay, perfect. I'll go from the top.
Okay.
Sounds good. So I was saying that although I will mention the 5 stages of grief, as I mentioned before, they're not orderly and not every person or patient can experience them all or just experience some. So for example, denial is a stage where the person may feel that the world's meaningless, life is overwhelming, and things don't quite make sense. Patients may feel numb. They may wonder how they can go on, if they can go on, or why they should go on. It also helps us cope and make surviving possible by pacing our feelings of grief. I like to call it a filtering process because it only allows you to deal with or handle what you can at that particular time. Instead of opening the floodgate of emotions and feeling completely overwhelmed, it's almost like having emotions and feeling little by little. As we accept the reality of the loss or the anticipated loss, we begin the healing process. In the stage of anger, this particular stage is also very necessary. So I always tell my patients to be willing to feel it. Hiding it or pretending that it doesn't exist doesn't quite help the process of healing through the loss of health or the loss of a loved one. Anger can be as intense as your love for yourself or your love of life or your love for the loved one. Underneath, unfortunately, there's a lot of pain because of the loss. And this can be extended to anyone in your circle. So it's important to be mindful of how you're acting and if anger is overpowering, because this can be reflected to your interactions with your children, your spouse, your parents, anybody in the community, the mailman, the lady at the supermarket. It does not matter. So it is important to be mindful of it. But when aware and when used appropriately, you can use it as strength to help you reconnect. The bargaining stage, it may be seen as a form of truce or peace agreement. Sometimes patient may try to make negotiation pacts with God or any other spiritual or superpower that they may believe they exist in an effort to ask for life to become back, to return to back to normal, or for the sickness to go away. And we may try to negotiate our way out of the pain. In the stage of depression, life and reality starts to sink in, and we may become more present of what is actually happening. It is important to remember that depression, when it's part of the grieving process, is not a sign of mental illness. And not because you're sad or you're crying or you're feeling a sense of sadness, you are struggling with a mental illness. Part of the process of grief involve having these feelings of uncomfortable sorrow. It is necessary to move on, and it is necessary for the process of healing. And last but not least is the process of acceptance. And I like to mention that not because we're accepting what is happening, we are okay with it. Basically, what we're doing is learning to live with the reality of our life at that moment. It is when we start moving forward, when we start reorganizing our roles, when we acknowledge what our needs are or the needs of our loved ones. And that's when we start making new connection and finding solutions. So cancer patients respond to accumulative losses. There's multiple losses involved in the process of grief in the face of a cancer diagnosis. Mental integrity is one of them. As we start understanding and accessing unfamiliar information and hospital systems that are unfamiliar to us, when we start learning new language that wasn't part of our daily routine, such as advanced directive, healthcare surrogate, Medicaid, Medicare, or any other kind of insurance issues, chemotherapies, immunotherapies, clinical trials, etc. And it's also when we start making a lot of different and difficult decisions. Another loss is the loss of independence or the loss of financial security. If there's inability to work or the loss of a job, how are we going to support ourselves? How are we going to support our family? Who is going to pay for all this? Physical strength and well-being is also a fear of loss. How would I feel? Would I be able to function? Will treatment hurt? The loss of the role on the family is also observed, where patients wonder who I am now. And this applies to patients, caregivers, and family members as roles may shift through the course of treatment. Other losses include the loss of personal relationships, whether it's a spouse or a partner, a parent through a child, or your relationship with your friends while you're going through cancer treatment. Also, the loss of functioning is very important at any age. Would I be able to be intimate with my spouse again? Would I be able to date again if you are not in a relationship? Self-image after treatment or surgeries may impact this kind of feelings. And last, life expectancy, the loss of a possible reduced longevity can cause severe fear and concerns. For patients, many may feel that they're not ready to die. I don't think anybody is. And for caregivers, I will not be able to live with or without her. Self-control is your ability to be able to get through all this in a way that is manageable, and that is also fear often in patients going through cancer treatment. So I'd like to point out that with the new diagnosis of cancer, patients and caregivers share many common fears, including having to put plans on hold. So it is important to remain flexible and accept that plans may change at any given time. Also, the fear about cancer treatment and potential side effects that we may or may not be aware of, such as pain, nausea, losing or gaining weight, or feeling fatigue, and whether or not the treatment may or not work, if the treatment may stop working. So it is important to remember that treatment can vary from person to person, and each person and each cancer treatment often is unique. If that person achieve remission or achieve a cure, will the worries of cancer coming back persist? Absolutely. The reality is that only time will tell how you will be able to continue living on. So that particular fear of cancer coming back can persist for a little longer. The important thing is that focusing on that can make you find yourself paying attention to every potential symptom that you may have, creating a lot of anxiety rather than enjoying your current remission status or your current state of well-being. And last, fear of dying or losing someone that you love is a part of the process, and certainly normal to struggle with that. So what is coping? Coping, we define it as the human behavioral process of dealing with adaptation or adapting to the demands, both internal or external, in situations that are perceived as a threat. And cancer is often perceived as a threat to ourselves or our loved ones. But it is important to remember, as many other organisms, we have to learn to adapt to our surroundings in an effort to live fully and be able to survive. So what are some of the factors that influence how we adapt or cope with cancer? Well, some are coming from our society. Whether or not we are willing to discuss openly our diagnosis or keep it a secret, whether or not we had a prior knowledge of cancer or disease through a loved one or a family member or friend, and popular belief. Do we think that cancer is terminal versus cancer being treatable? Some other factors come from patient themselves, and those can be divided as interpersonal, coming from within, meaning the stage of the disease, my coping abilities, emotional maturity, a spiritual belief, religious belief that may influence how we cope, and others are interpersonal. My spouse, my family members, my friends, my social support, whether or not there are small children in the family, and our socioeconomical status. And last but not least, other factors that influence how we cope or adapt are coming from the cancer itself. The location of the cancer, the stage of the cancer, and the treatment required to treat that particular cancer. Alter body structures due to surgeries or functional decline, rehabilitation or restoration of functioning, whether it's available or not, is going to influence how we cope with the disease. There's two types of coping strategies. One is problem focused and the other one is emotion focused. The problem focused strategy, as it is listed, focus on the problem itself. Is when we try to fix what is wrong. But when it comes to chronic illnesses or illnesses like cancer, where the stress is outside of the person's control, an emotional focus strategy is more realistic. This particular strategy allow us to focus our energy in dealing with our feelings rather than the problem itself. The goal is to be able to reduce those negative emotions in response to the disease and what is happening, and to avoid added stress such as embarrassment, fear, anxiety, depression, anger, or frustration. So what do we do when we're trying to cope with cancer? Although easier to say than done, it is important to remember and recognize that sometimes we have to let go. We have to recognize first that we cannot control everything. And sometimes cancer is one of those illnesses that although we can influence the treatment, we may not control the disease itself. Practicing meditation, mindfulness, and journaling can help you become more resilient. Research actually has shown that people with higher intolerance for uncertainty may be less resilient and more prone to low mood, depression, negative feelings, and anxiety. It is important to get informed. That's something that you can do. The more you know about your condition, the better equipped you will be to understand what is happening to you and your body and why. Take charge of what you can control. Maintain healthy habits like diet, exercise, keeping regular visits, taking your medications, etc. Advocate and speak for yourself. It is important to advocate for what is happening to you, as that helps you gain independence, become more responsible, and obtain what you need and what you require. And last, reach out to others, such as your medical providers if you need help, teachers, employers, family, friends, and others if you need help. It is important to maintain and build new relationships. And it is also important to continue building your team or your army with friends and family as you go through cancer treatment. It is also important to connect with other patients and survivors, as that can help you learn from each other's experiences and recognize that you are not alone in your struggles. This may also help you feel supported and empowered. So as we continue talking about coping with cancer, using stress reduction strategies proactively is very important. walk or exercise when you can, and eat and sleep well always. Do things that you enjoy and make intentional schedules of social activities to reconnect with those that you love. Practice mindfulness, which is nothing else other than being present. Practicing mindfulness helps us develop an attitude of calmness and remaining in the moment. Be neutral with a non-judgmental attitude towards what is happening in our lives. Practicing living in the moment can help you enjoy the good that we have now rather than focusing on the future worries or what we have lost or what we think we have lost. Developing a neutral attitude also helps us not judge our life circumstances today, but instead focus on those areas in which we do have control. The goal is to embrace your life as is, with the difficulties and the joys, the challenges and the rewards. Be aware of depression and anxiety that doesn't go away, and ask for professional help if you need to. So what about caregivers, and who is a caregiver and what is a caregiver? So caregivers are anyone who provides physical, emotional, financial, spiritual, logistical support to a loved one with cancer. They can be partners, family members, friends, neighbors. They could be nurses. They could be anyone that is helping you get through your treatment. They can help with daily activities such as going to the doctors, making meals, coordinating services and care. They often give emotional and spiritual support to their loved ones, and they are part of the medical team. They give drugs, they manage side effects, they communicate problems, and they keep others informed and help with decisions about treatment. The caregiver's role can change often depending on the patient's need during and after treatment. As a caregiver, you have a huge influence, both positive and negative, on how cancer patients deal with their illnesses. Your support can help the patient continue with the demands of the treatment and take other steps to get well, like eating and resting and exercising when necessary. Caregivers help patients stay involved and make decisions about their medical care. But as patients, caregivers have expectations. And expectations can be different between a patient and a caregiver. So it is important to remember, everyone, that communication with the person you are caring for is the most important part of your role. It is important to remember that people communicate differently. So how can you help your loved one when you are serving as a caregiver? Let your loved one know that you are available to help, but don't pressure, don't push. Words don't say everything. Try sharing your support by writing or by using gestures or by behaviors that are caring with expressions or touch. Help your loved one keep their routine and life as close to normal as possible. But also be realistic and be flexible about what you hope to talk about and what you hope to agree with your loved one when you're serving as a caregiver. Learn to take cues from the person you are caring for. Sometimes you may need to step in when your patient or your loved one is having challenges, and other times you may need to sit back and let your family member, your loved one, take control over their care. Respect the needs to be alone. Sometimes we all need to be alone, even you as a caregiver. And it is important that caregivers pay attention to their self-care. Be comfortable accepting help from others. Not because you're helping your loved one doesn't mean that you don't need help. There's going to be a time where you will need to delegate responsibilities or prioritize activities that are less important in an effort to stay whole and safe. It is okay to admit that whatever you're doing is difficult and that caring for your loved one is difficult, because it is. It is very difficult. And make sure you take time to care for yourself in an effort to be able to continue serving as a caregiver. So when do we ask for professional help? It is important to remember that if you're experiencing frequent sadness, excessive worrying or anxiety, or even anger or angry outbursts that don't go away, that you ask for professional help. If that sadness or worries are affecting your ability to eat or sleep, to ask for help. If you're less interested in things that you used to enjoy, whether it is your children's, your hobbies, your friends, please ask for help. If that sadness or worries are affecting your relationship with your friends and families, also ask for help. And if you're feeling that you are having difficulties making decisions about your life or the future, maybe it's time to ask for help. And last but not least, if you ever have thoughts of death or dying, or have any desire to end your life because you're feeling hopeless and worthless and helpless, please ask for help. Managing depression and anxiety in cancer patients can come in different ways. Counseling and psychotherapy is just one form of therapies. These particular therapies focus on identifying specific problems, behaviors, or ways of thinking which may be amenable to change. In some cases, medications can also help if symptoms are severe and are affecting your ability to function at home, at school, or at work. The goal is to reduce the suffering and help the person with cancer have a better quality of life. So who can help you? The oncologist, first of all, as the leader of your team, can be the first person to go to. They know you, they have been working with you, and they may be able to identify areas of treatment that can complement you or help you move forward. A psychiatrist like myself can be consulted to assist patients that are struggling with severe depression, anxiety, or other challenging symptoms like insomnia, etc. Psychologists can help in providing counseling and psychotherapies, and so is master level professionals such as licensed mental health counselors, clinical social workers, and marriage and family therapists, as they often assist patients and their caregivers and other family members deal with uncomfortable circumstances or symptoms that may be difficult to manage. What is the therapist's role? Will complete an assessment and identify emotions or behaviors that are difficult to handle. They may help you distinguish between illness-related symptoms and emotional reactions that are subjective to change. They can guide with decision-making process, and they can help you identify what is it that you want or you do not want from treatment, and also help with goals of care. They can teach coping skills and provide focus and sometimes brief therapies to address current problems, such as cognitive behavioral therapy and acceptance and commitment therapies. And how can caregivers help patients when they're struggling with depression and anxiety? Well, gently inviting your loved one to talk about their fears and concerns without forcing it can be a place to start. It is important to listen carefully without judging the patient's feeling. I think we all agree to disagree, so it is okay to point out and disagree with a self-defeating thought without taking away the patient's perspective. Avoid telling a patient to cheer up or don't think about that, because often that doesn't help. Patients may feel that they're being dismissed or that their feelings are not being taken into account. Talk about what you can do to support each other. Remember, you and the patient or caregiver and the patient are a team. And there's other members of the team that can help each other in moving forward. Engage the person or the patient in activities they enjoy. Try to just seek out that connection to get them back to painting or listening to music or reading or just enjoying a time away. Whatever it is that they enjoy, try to reconnect them with those activities. Don't try to reason, however, with a person that is struggling with severe anxiety or severe depression or severe fear, because the reality is that it's not going to help. You're just going to be butting heads. If you're finding that your interventions are not fruitful and you're not able to help your loved one, that will be the opportunity of using your caregiver role to get help for someone from the cancer care team to get additional help and support. And remember, many of the things that we have discussed can also apply to caregivers, because caregivers can also become depressed and anxious. So all these suggestions may be used for caregivers as well. And last but not least, love yourself, accept yourself, forgive yourself. Be good to yourself, because without you, the rest of us are without a source of many wonderful things. All of us have something to contribute as we interact with each other. So it is important to stay connected. I like to think that we were not meant to be alone. So maintaining connection, seeking help, and asking for something that you may not do yourself is always important, and it's not a sign of weakness. It only shows that you are willing to continue moving forward and receive the help that you may need at that time. All right.
All right. Wow. Thank you so much for sharing with us today, because I know that this topic is something that it's not really discussed with your doctor when you get diagnosed, and a lot of people may be blindsided with these type of feelings. And it's important for this to be, you had mentioned, normalized, and that's a really good descriptor for it, because this is something that everybody goes through, and it's something that that we hope to shed more light on and let people know that, you know, it's okay to have these feelings. It's okay. And so thank you so much for that. If anyone does have questions, you can type them into the chat here. I know that the majority of the views that we get on these types of content come through the video. So if, as we get questions through social media and through email and our website, would it be all right if we reach out to you to get those answered?
Absolutely. Absolutely. And one thing that I wanted to, also notice is that we see patients struggling at different stages. It's not always at the beginning, it's not always at the middle, it's not always at the end. The reality is that every patient is different. Sometimes with the diagnosis, we see patients that are go, 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 and we're looking for answers and we're looking for treatment, and we are focused. We are laser focused on trying to do everything we can to treat the disease. And then emotions kind of take a second or a back role. And then when things are better and we achieve a level of plateau and there's not much chaos, then we start feeling what we kind of put on hold. So for me, it is important to communicate to not just patients, but the general public, that there's no one way to feel when we're dealing with adversity or inability to cope or trying to get through cancer. So be true to yourself. The reality is that there's not one way to do this. Every patient has to be able to have their own space, their own recipe, their own opportunities. So validating and acknowledging that this is somewhat normal at the beginning, but if it's causing trouble, it is important to ask for help, is what I hope to communicate and pass along with this kind of topics and discussions.
Well said. If anyone missed any portion of today's talk, it has been recorded and we'll be sharing it on our social media and on our website on Monday. And so also, we do have some upcoming kidney cancer conversations. The next one will be on April 20th at 1:30. And a clinical social worker, Mark McDowell, will be talking about financial distress with cancer. You must know him. I see you smile. So awesome. Well, thank you so much, Doctor, for sharing your insights, and everyone have a great day.
Thank you so much. I appreciate inviting me.
Thank you. Take care now.